Hello, everyone. My name is Imarhia Enogieru, and I just love the sound of that song, Lean On Me, don't you? Its sweet melody uplifts your mood, and its message is so powerful and comforting. If you feel overwhelmed, knowing that you have someone to help share a heavy burden can help make that burden feel much lighter. It's a message we've heard a lot today from Dr. Bradley and my predecessors here. It's a message that embodies why I'm currently in medical school and my want to become a physician. It's also a message that embodies my time as a licensed practical nursing student. I still remember this one patient, Mrs. W., a woman in her mid-40s admitted to the hospital after surgery. Her boisterous laugh filled the room as I entered. Her bright smile widened once she found out I was a student. She wanted to make sure that I learned everything I possibly could from her, whether it was about her diabetes, her kidney failure, or the best Italian food in Davie, Florida. As part of my daily nursing care, I made sure to measure her blood glucose. The blood drained from her face when she saw her elevated numbers. I went straight into LPN mode and I asked her what was wrong. She was disappointed because she'd worked so hard to manage her blood glucose levels through meal planning and exercising. Well, from that, I was able to define her problem. She had a decrease in self-confidence in her ability to manage her diabetes. Well, I had to intervene. I reminded her that she'd been in the hospital for a couple of days and this could have affected her blood glucose levels. I also encouraged her and told her that this is one setback in her management journey and she should be proud of how hard she'd worked up until this point. She agreed with me, and the light turned on again and she was back to laughing and joking. But most importantly, she was excited to continue to take care of her diabetes. That day, Mrs. W showed me how powerful LPN skills are when it comes to encouraging patients and how that encouragement could lead to an increase in self-management behaviors. I was able to take care of patients as an LPN student because I was trained to listen to patients' concerns about their health and also their values about their health. With that knowledge, I was better able to educate them on how to self-manage their care. Also, LPNs are trained in the organized framework seen here as API. I was able to assess patients' needs, diagnose their problems, plan interventions to help solve those problems, and then evaluate my interventions to see if they were successful or not. It was this framework that I used to solve Mrs. W's self-confidence issue. In fact, it was this framework that I used to design my project for the Center of Primary Care Innovations Fellows Program. Now, I'm currently working with Dr. Nisha Basu, a primary care physician and a primary care innovations fellow at Beth Israel Deaconess Medical Center. Her and her colleagues are interested in reducing the number of patients with hemoglobin A1Cs greater than 8. A hemoglobin A1C is a measurement of long-term glucose levels, and one that's greater than 8 increases a patient's risks for heart attacks, strokes, eye issues, and kidney issues. So we hope to reduce this number by increasing self-management behaviors, and we can do this through API. First, we will assess. We created an assessment tool that screens patients for different barriers to their self-management care. Once patients answer the self-management assessment, we're able to define their barriers. With that definition, we can intervene by referring patients to resources inside and outside of the hospital that can help reduce their barriers to care. And after, we can evaluate. We can follow up with patients to see if they were actually able to engage in self-management behaviors. Now, this is a multidisciplinary team effort, and I think it'd be beneficial to walk Mrs. W through this. Before she comes in for her visit, medical assistants and her primary providers are already huddling about her care. Once she comes in, the medical assistant hands her the assessment tool and asks her to answer the questions. Then she can give it to her primary provider, who can review the sheet and discuss any pertinent issues. Her primary provider can be her physician or her nurse practitioner. During the review, the primary provider discovers that Mrs. W has issues with exercising, so the primary provider can refer her to the team LPN. Now, as I mentioned before, LPNs are trained in the art of patient-centered care and also have an organized framework for identifying and solving patient issues. Therefore, the LPN is the perfect healthcare professional to undergo this follow-up process with Mrs. W. So they have a discussion, and the LPN discovers that Mrs. W has an issue with affording exercise facilities and also doesn't really like to exercise, but does love to dance. So they make a goal. The LPN says that Mrs. W will attend a free Zumba class twice a week for the next 2 weeks. Also, the LPN will introduce her to the community resource specialist, who can help her find affordable exercise facilities in her area. Then the LPN can follow up in 2 weeks. If Mrs. W was able to complete her goal, the LPN can congratulate her and try and harness that energy towards the next steps in her self-management journey. If she was unable to complete that goal, the LPN can support her, try to understand her barriers towards completing the goal, and then create new goals that are much more manageable and much more attainable. I can still see the frustration and disappointment on Mrs. W's face when she saw how elevated her numbers were. It was as though all her hard work had vanished with the push of a button. This was her heavy load. This was the time when she needed someone who she could lean on, someone who could listen to her concerns and help her solve her problems. And she's not alone. There are 25.8 million Americans undergoing the same self-management struggle with diabetes. A chronic illness like diabetes needs complex disease management in order to be successful, and complex disease management needs a team effort. Since LPNs are trained in the art of patient-centered care and also have a framework for understanding patients' problems and helping to solve those problems, I believe LPNs can be a critical part in that team by empowering and supporting patients. Thank you.